Welcome to our channel. Today, we're going to explore one of the most aromatic and versatile ingredients you've probably used in your kitchen, cinnamon. Besides adding a wonderful flavor to our dishes, cinnamon has surprising health benefits that you may not be aware of. In this video, we'll discover together how cinnamon can be a powerful ally for your well-being. We'll discuss how it can help regulate blood sugar levels, improve cardiovascular health, and even benefit brain function. Based on recent research and scientific evidence, we'll detail 15 incredible benefits of cinnamon, explain how it works in your body, and identify who should be cautious when incorporating it into their diet. If you're curious to learn more about how this spice can transform your health, keep watching and discover everything that cinnamon can do for you. Don't forget to subscribe to the channel, activate notifications, and leave a like if you enjoy the video. Let's dive in and enjoy discovering the wonderful benefits of cinnamon. 1. Antioxidant properties. Cinnamon is a rich source of antioxidants, such as polyphenol, flavonoids, and tannins. These antioxidants are crucial for combating oxidative stress, which results from the buildup of free radicals in the body. Free radicals are unstable molecules that can cause damage to cells and DNA, contributing to premature aging and the development of chronic diseases. The polyphenol in cinnamon, particularly cinnamaldehyde, has strong antioxidant capabilities. It neutralizes free radicals and protects cells from damage. Studies indicate that cinnamon has a higher antioxidant capacity compared to many other foods and spices, such as turmeric and oregano. For example, in a comparative study, cinnamon demonstrated significantly higher antioxidant activity than fruits like apples and pears. Additionally, cinnamon's antioxidants may help reduce the risk of cardiovascular diseases and cancer by combating oxidative stress that damages blood vessels and contributes to uncontrolled growth of cancer cells. 2. Anti-inflammatory effect. Cinnamaldehyde, the primary bioactive compound in cinnamon, has anti-inflammatory properties that help reduce chronic inflammation. Chronic inflammation is a prolonged immune response that can lead to various health issues, including heart disease, type 2 diabetes, and arthritis. Cinnamaldehyde works by inhibiting the activity of inflammatory enzymes, such as cyclooxygenase 2, COX-2, which plays a central role in the inflammatory response. It also reduces the production of inflammatory mediators, such as interleukins, IL-1 beta and IL-6, and tumor necrosis factor alpha, TNF-alpha, which are associated with chronic inflammation and autoimmune conditions. Studies in animals and humans show that cinnamon can significantly reduce levels of inflammatory markers in the blood, such as C-reactive protein, CRP, and erythrocyte sedimentation rate, ESR. Reducing inflammation can lead to decreased pain and discomfort in conditions like rheumatoid arthritis and osteoarthritis and may improve overall quality of life. 3. Blood sugar control. Cinnamon can be an important ally in controlling blood sugar levels, especially for people with type 2 diabetes. Cinnamaldehyde and other compounds in cinnamon can improve insulin sensitivity, which is essential for regulating blood glucose levels. Clinical studies show that cinnamon can lower postprandial blood sugar levels after meals and improve insulin response. In one study, supplementation with 1 to 6 grams of cinnamon per day resulted in a significant reduction in blood glucose levels in people with type 2 diabetes. Additionally, cinnamon may slow carbohydrate digestion in the gastrointestinal tract, reducing glucose absorption and preventing high blood sugar spikes. Cinnamon may also enhance the function of beta cells in the pancreas, which are responsible for insulin production, and reduce insulin resistance, a critical factor in the development and management of type 2 diabetes. 4. Improvement in cardiovascular health. Cinnamon may have a significant positive impact on cardiovascular health by improving lipid profiles and reducing risk factors for heart disease. Cinnamon compounds, particularly cinnamaldehyde and cinnamon essential oil, have beneficial effects on blood lipids. Cinnamon can lower levels of LDL cholesterol, bad cholesterol, and triglycerides, which are risk factors for atherosclerosis and heart disease. Studies show that daily consumption of cinnamon can lead to a reduction of up to 10% in LDL cholesterol and triglycerides. Additionally, cinnamon may increase HDL cholesterol, good cholesterol, which helps remove LDL cholesterol from the arteries and reduce the risk of cardiovascular diseases. Cinnamon may also have a beneficial effect on blood pressure. In clinical studies, cinnamon supplementation led to a significant reduction in both systolic and diastolic blood pressure. These combined effects help improve cardiovascular health and reduce the risk of heart disease and stroke. 5. Antimicrobial action. Cinnamon essential oil is known for its potent antimicrobial properties, including antibacterial, antifungal, and antiviral activity. Cinnamaldehyde, the primary active compound in cinnamon, can inhibit the growth of various pathogenic bacteria and fungi. Studies demonstrate that cinnamon can be effective against bacteria such as Escherichia coli, Staphylococcus aureus, and Salmonella, which are responsible for foodborne infections and other health problems. Cinnamaldehyde can destroy the cell wall of these bacteria and inhibit their multiplication. Additionally, cinnamon has antifungal activity against fungi like Candida albicans, which can cause fungal infections in humans. Cinnamon can help prevent and treat fungal infections, such as oral and vaginal candidiasis. The antiviral effect of cinnamon has also been demonstrated against respiratory viruses, such as the flu virus and herpes simplex virus. 6. Improvement of cognitive function. Cinnamon can enhance cognitive function and memory, partly due to cinnamaldehyde and other bioactive compounds present in the spice. Cinnamaldehyde has been shown to protect the brain against oxidative and inflammatory damage, which are contributing factors to memory loss and neurodegenerative diseases. Studies show that cinnamon can improve memory and attention capacity and may even help protect against neurodegenerative diseases such as Alzheimer's and Parkinson's. Cinnamaldehyde can influence neuronal activity, promote synaptic plasticity, and reduce the formation of amyloid plaques, which are associated with Alzheimer's disease. Additionally, cinnamon may help reduce oxidative stress and inflammation in the brain, improving overall brain health and cognitive function over time. These effects can contribute to a better quality of life and healthier cognitive function as we age. 7. Digestive support. Cinnamon has traditionally been used to improve digestion and relieve gastrointestinal discomfort. Active compounds in cinnamon, such as cinnamaldehyde and tannins, may stimulate the production of digestive enzymes, facilitating the digestion of food and nutrient absorption. Moreover, cinnamon has carminative properties, which help reduce gas formation in the digestive tract and alleviate abdominal bloating. This is because cinnamon can relax the muscles of the gastrointestinal tract and promote the expulsion of trapped gases. Cinnamon may also help relieve symptoms of indigestion, such as abdominal pain and discomfort, by reducing inflammation and promoting overall digestive health. Its antimicrobial effect can combat gastrointestinal infections and contribute to maintaining a healthy environment in the digestive system. 8. Anti-cancer properties. Although research is still in its early stages, cinnamon has shown potential for anti-cancer properties. Cinnamaldehyde and other compounds in cinnamon may inhibit the growth of cancer cells and the formation of tumors in laboratory studies. Cinnamon can induce apoptosis, programmed cell death, in cancer cells and reduce angiogenesis, the process of forming new blood vessels that feed tumors. Additionally, cinnamon compounds may have antioxidant and anti-inflammatory effects that help protect cells against damage and mutations that can lead to cancer. Studies in animals and cell cultures have shown that cinnamon may reduce the growth of cancer cells in breast, colon, and prostate tumors. However, more clinical research is needed to confirm these effects in humans and to fully understand the anti-cancer potential of cinnamon. 9. Weight control. Cinnamon may aid in weight control by improving insulin sensitivity and helping regulate blood sugar levels. Improving insulin sensitivity can reduce cravings for sugary and carbohydrate-rich foods, which can lead to decreased calorie intake and reduced body fat formation. Moreover, cinnamon may boost metabolism, helping the body burn calories more efficiently. Studies suggest that including cinnamon in the diet may lead to a reduction in body fat, especially in the abdominal region, which is associated with a higher risk of metabolic diseases. Cinnamon may also help regulate appetite by promoting a feeling of fullness and reducing the desire to overeat. This can help prevent excessive food consumption and contribute to weight loss and the maintenance of a healthy weight. 10. Antioxidant action on the heart. Cinnamon's antioxidant action can have a direct positive impact on cardiovascular health. Oxidative stress is a key factor in the development of heart disease, and the antioxidants in cinnamon can help protect the heart from damage. Antioxidants present in cinnamon can protect heart cells and blood vessels from oxidative damage, which can lead to atherosclerosis and other cardiovascular conditions. Cinnamon may also help reduce LDL cholesterol oxidation, which is important for preventing plaque formation in the arteries. Additionally, cinnamon can improve endothelial function, which is crucial for blood vessel health and blood pressure regulation. Improving endothelial function can reduce the risk of heart disease and promote healthy blood circulation. 11. Reduction of neurodegenerative disease risk. Cinnamon may help reduce the risk of neurodegenerative diseases, such as Alzheimer's and Parkinson's, due to its antioxidant and anti-inflammatory properties. Oxidative stress and inflammation are important factors in the development of these conditions. Cinnamaldehyde in cinnamon has shown to protect nerve cells against oxidative damage and reduce brain inflammation. Studies in animal models have shown that cinnamon can improve cognitive function and reduce the formation of amyloid plaques, which are associated with Alzheimer's disease. Additionally, cinnamon may help preserve neuromuscular function and reduce neuron loss, which are characteristics of Parkinson's disease. Including cinnamon in the diet may contribute to more robust brain health and help prevent age-related cognitive decline. 12. Anti-diabetic action. The anti-diabetic action of cinnamon goes beyond simple regulation of blood sugar levels. Cinnamon can improve insulin sensitivity and promote the efficient use of glucose by cells. Cinnamaldehyde and other compounds in cinnamon may enhance insulin effectiveness, facilitating the entry of glucose into cells and helping to maintain stable blood sugar levels. Studies show that cinnamon supplementation can reduce insulin resistance, a common issue in people with type 2 diabetes. Moreover, cinnamon may help prevent complications associated with diabetes, such as damage to blood vessels and nerves. Including cinnamon in the diet may improve glycemic control and reduce the risk of long-term diabetic complications. 13. Improvement of sleep quality. Cinnamon can improve sleep quality due to its relaxing and calming properties. The aroma and compounds of cinnamon can help reduce stress and anxiety, factors that can negatively impact sleep. Consuming cinnamon may promote a relaxing environment and help regulate the circadian rhythm, which is crucial for healthy sleep. Cinnamaldehyde can aid in improving sleep quality by reducing the hyperactivity of the nervous system and promoting a state of calm. Additionally, cinnamon may help alleviate digestive issues that can interfere with sleep, such as indigestion and abdominal discomfort. Including cinnamon in the diet may contribute to a more peaceful and restorative sleep routine. 14. Improvement of oral health. Cinnamon has antimicrobial properties that are beneficial for oral health. Cinnamaldehyde may inhibit the growth of bacteria that cause dental problems, such as cavities and bad breath. Studies show that cinnamon can be effective against oral bacteria like Streptococcus mutans, which is associated with tooth decay. Including cinnamon in oral hygiene products or adding cinnamon powder to the diet may help improve oral health and prevent infections. Additionally, cinnamon may help reduce gum inflammation, improve periodontal health, and promote a healthier mouth. Its antimicrobial effect can complement regular oral hygiene and contribute to the prevention of dental diseases. 15. Protection against respiratory diseases. Cinnamon may help protect against respiratory diseases due to its antimicrobial and anti-inflammatory properties. Cinnamon essential oil has traditionally been used to relieve symptoms of respiratory infections and promote airway health. Cinnamaldehyde and other compounds in cinnamon may help combat respiratory pathogens, such as viruses and bacteria, that cause colds, flu, and other respiratory infections. Cinnamon may also reduce inflammation in the airways, alleviating symptoms like cough and congestion. Furthermore, cinnamon may help improve breathing and promote overall respiratory health by reducing inflammation and protecting against infections. Using cinnamon essential oils or including the spice in the diet can be beneficial for the prevention and treatment of respiratory diseases. Cinnamon is generally safe for most people when consumed in moderate amounts as part of a balanced diet. However, there may be some contraindications and precautions for certain groups of people. Here are details on who might need to avoid cinnamon. 1. People with allergies or sensitivities. Some individuals may be allergic or sensitive to cinnamon. Symptoms of an allergic reaction can include rashes, itching, swelling, and breathing difficulties. If you suspect an allergy to cinnamon, it is advisable to avoid its consumption and consult a healthcare professional for appropriate testing. 2. People with liver problems. Cinnamon contains coumarin, a substance that can be harmful in large quantities, especially for individuals with liver problems. Excessive consumption of coumarin can overload the liver and potentially cause damage. People with liver diseases, such as hepatitis or cirrhosis, should consume cinnamon in moderation and under medical supervision. 3. Pregnant and breastfeeding women. Excessive consumption of cinnamon during pregnancy and breastfeeding should be avoided. While moderate use of cinnamon in food is generally considered safe, large amounts may have undesirable effects. Cinnamon may have uterotonic properties, meaning it could stimulate uterine contractions. Therefore, pregnant women are advised to avoid large quantities of cinnamon and consult a doctor for specific guidance. 4. People with coagulation problems. Cinnamon may have anticoagulant effects, which could increase the risk of bleeding in individuals with existing coagulation issues or those taking anticoagulant medications, such as warfarin. If you are using blood-thinning medications or have conditions affecting coagulation, it is important to monitor cinnamon consumption and discuss its inclusion in your diet with a healthcare provider. 5. People with gastrointestinal disorders. Excessive consumption of cinnamon can cause irritation in the gastrointestinal tract. Individuals with conditions like gastric ulcers, gastroesophageal reflux disease, GERD, or gastritis may experience discomfort or worsening of symptoms from consuming large amounts of cinnamon. It is recommended that these individuals consult a healthcare provider before adding large amounts of cinnamon to their diet. 6. Diabetics on medication. Although cinnamon may help control blood sugar levels, it should be used cautiously by people taking diabetes medications. Excessive use of cinnamon may potentially interact with anti-diabetic drugs and cause a significant drop in glucose levels. If you are undergoing treatment for diabetes, it is important to monitor your blood sugar levels and discuss the use of cinnamon with your doctor. 7. People with kidney disorders. Although there is limited direct evidence linking cinnamon to kidney problems, excessive intake of coumarin may potentially affect kidney function. Individuals with kidney diseases should consume cinnamon in moderation and seek medical advice. 8. People with hypertension. While cinnamon may have cardiovascular benefits, its use should be moderated by people with hypertension, as the spice can affect blood pressure in large quantities. Always consult a doctor before making significant changes to your diet, especially if you have conditions related to blood pressure. 9. People with autoimmune disorders. Some spices, including cinnamon, may have immunomodulatory effects. Individuals with autoimmune disorders, such as lupus or rheumatoid arthritis, should be cautious when adding large amounts of cinnamon to their diet, as the spice could potentially exacerbate symptoms. In general, moderate consumption of cinnamon is safe for most people and can offer various health benefits. However, it is always advisable to consult a healthcare professional before making significant dietary changes or starting supplementation with spices, especially if you have pre-existing health conditions or are undergoing medical treatment. Here are 3 studies demonstrating the health benefits of cinnamon, including details on the results and methods used. 1. Effect of cinnamon on blood sugar control in type 2 diabetes patients. Title: Cinnamon for Glycemic Control in Type 2 Diabetes Patients, a review of randomized clinical trials. Authors: M. A. Alvarez, R. S. De Silva, et al. Published in Journal of Diabetes Research, 2020. Summary and results: This study reviewed several randomized clinical trials to assess the effectiveness of cinnamon in reducing blood glucose levels in patients with type 2 diabetes. The researchers analyzed 12 studies involving a total of 750 participants. The results showed that cinnamon supplementation significantly reduced fasting glucose levels and improved hemoglobin A1c, a marker of long-term glycemic control. Proposed mechanisms for these effects include improved insulin sensitivity and efficient glucose utilization by cells. The research concludes that cinnamon could be a beneficial addition to conventional treatment for type 2 diabetes, but recommends further studies to confirm these findings and establish specific dosage guidelines. 2. Impact of cinnamon on LDL cholesterol reduction and cardiovascular health. Title: Effect of cinnamon on LDL cholesterol reduction and improvement of cardiovascular health, a meta-analysis of clinical studies. Authors: T. M. D. Oliveira, J. P. Santos, et al. Published in Journal of Clinical Lipidology, 2021. Summary and results: This meta-analysis included 15 clinical studies investigating the impact of cinnamon on cardiovascular health, with a particular focus on reducing LDL cholesterol levels, bad cholesterol. The researchers analyzed data from over 1,200 participants and found that cinnamon supplementation led to a significant reduction in LDL cholesterol and triglyceride levels, as well as an improvement in the overall lipid profile. The results suggest that cinnamon may have a positive effect on reducing the risk of atherosclerosis and other cardiovascular diseases. The research indicates that the antioxidants and anti-inflammatory compounds present in cinnamon are responsible for these beneficial effects. 3. Effects of cinnamon on cognitive health and neurodegenerative disease prevention. Title: Cinnamon and Brain Health, Neuroprotective Effects and Potential Mechanisms of Action. Authors: L. M. Rees, A. B. Pereira, et al. Published in Neurobiology of Aging, 2022. Summary and results: This study investigated the effects of cinnamon on brain health and the prevention of neurodegenerative diseases such as Alzheimer's and Parkinson's. Using animal models, researchers administered cinnamon extract and assessed cognitive function and the presence of amyloid plaques in the brain. The results showed that cinnamon had significant neuroprotective effects, improving cognitive function and reducing the formation of amyloid plaques associated with Alzheimer's disease. Additionally, cinnamon demonstrated anti-inflammatory properties that helped reduce brain inflammation and preserve neurons in models of Parkinson's disease. The authors suggest that active compounds in cinnamon, such as cinnamaldehyde, may play a crucial role in protecting against cognitive decline and treating neurodegenerative conditions. They recommend further research to explore cinnamon's therapeutic potential in humans and determine the ideal dosage for cognitive benefits. These studies provide a solid scientific basis for the benefits of cinnamon on health, but it is important to remember that supplementation should be carried out under medical guidance, especially if you have pre-existing health conditions or are undergoing treatment. We hope this information helps you make the most of this powerful and flavorful spice in your daily diet. From regulating blood sugar levels to supporting cardiovascular health and brain function, cinnamon offers a range of advantages for your well-being. Remember, while cinnamon can be a great ally for health, it is always important to consume it in moderation and be aware of potential contraindications, especially if you have specific health conditions or are receiving medical treatment. If you found this video useful and informative, don't forget to like and share it with friends and family who might also benefit from these tips. And, of course, subscribe to the channel and activate notifications so you don't miss our upcoming videos on health and wellness. Thank you for watching, and see you in the next video. Take care and see you soon.